Hello everyone, this is Dr. Esha Arora. I'm a medical officer working at District Hospital in Mohali. And today I will be discussing with you all about polypharmacy. So what is polypharmacy? It is often defined as the concurrent use of 5 or more medications, and it is an increasingly important concern in geriatric healthcare. As we all know that in India, the aging population is rising rapidly due to improved life expectancy, better management of chronic diseases, and these older adults suffer from multiple comorbidities like hypertension, diabetes, cardiovascular diseases, arthritis, chronic respiratory disorders, and this leads to frequent prescription of multiple drugs. Now, this polypharmacy carries significant risks like adverse drug reactions, drug-to-drug reactions, but in this scenario, sometimes it is very challenging to avoid polypharmacy. So this lecture is all about how you can critically think and prescribe in such a way that you maximize the benefits of medication to the patient while minimizing the potential harmful effects. Now, in an Indian context, this polypharmacy is even more complicated. Why? Because there is a very easy availability of the over-the-counter drugs, and also many patients also concurrently rely on Ayurvedic treatment or herbal treatment. So this further complicates the matter. So let's discuss a little more about polypharmacy. Allow me to share my screen with you so that I can share my PPT. So over the next 10 to 15 minutes, we would be talking about polypharmacy. What is polypharmacy? What are its determinants and prevalence, its risks and health outcomes? We would be discussing about the public health implications, and we would also talk about certain strategies for prevention and management. Now, as already discussed, polypharmacy is use of 5 or more medications concurrently. And sometimes it is appropriate, as we have discussed in certain scenarios where the patient has multimorbidity, we cannot just avoid but prescribe multiple medicines to the patient. And it not only includes the prescription which you give, but also the over-the-counter drugs the patient might be taking and not knowing about it. It also includes the supplements, multivitamins, and traditional medicines the patient is taking. Now, this issue of polypharmacy is rising globally due to the aging population, increase in aging population, increase in multimorbidity, and easy access to medications. And when we talk about India specifically, there is a high burden of NCDs, which leads to multimorbidities and prescription of multiple medications. Also, as we have discussed, issues like self-medication, OTC availability, concurrent use of Ayurvedic or alternative medicines increases the risk of polypharmacy, especially in our Indian scenario. Also, in India, we see there is a fragmented healthcare delivery system. That is, the patient might be himself going to multiple specialists and taking multiple prescriptions from these doctors with each one of them not knowing about each other's prescription. So this leads to sometimes, overprescription or prescription of drugs belonging to the same class, leading to overprescription and wrong prescriptions. Now, India specifically has a prevalence of 15 to 40% of polypharmacy, especially among older adults, and this is higher in urban tertiary care settings. There is an increasing trend because of chronic diseases. Now, what are the health risks of polypharmacy? Why are we so concerned about polypharmacy? So one, as we all know that, when the patient is taking multiple drugs, there is drug-to-drug or drug-disease interactions. But other than that, the patient might have multiple adverse drug reactions, especially the geriatric population, which is more prone to frailty, increased risk of falls, malnutrition, non-adherence to drugs, cognitive decline, and increased admissions to hospitals. So what are the clinical indicators of polypharmacy in a patient? When the patient is taking 5 or more concurrent prescriptions, there are multiple prescribers involved when the patient is going doctor hopping, visiting different doctors. There is duplicate or inappropriate therapy, drug-to-drug interactions. High-risk drugs are used in elderly like NSAIDs or benzodiazepines. When there is complex dosing schedules, when the patient shows symptoms of adverse drug reactions like falls, confusion, GI issues, and when there is concurrent use of alternative medicines. Now, in the public health scenario, why polypharmacy is significant? Because it increases the economic burden, not only to the families, but also to the healthcare system, because the patient's safety is at risk, and the patient is, there's an increased admission of patient to the hospitals. It also increases out-of-pocket expenditures. And also, very importantly, it also contributes to antimicrobial resistance. Now, this is a typical case example. It's a 72-year-old female from India who is suffering from diabetes, hypertension, and arthritis. She's already taking 8 medicines daily. And to add to that, the patient is also taking a few OTC painkillers whenever she has pain and certain herbal supplements for her knee pain. So, over the months of taking this therapy, she eventually develops gastritis and renal dysfunction, which leads to hospitalization. So, as you see, this case typically highlights the systemic risks of unmonitored polypharmacy. Now, what strategies healthcare professionals can adopt to prevent polypharmacy in their patients? First and foremost is medication review at every visit. So make sure at every visit when the patient comes to you, review what all medicines the patient is taking. And I always recommend that ask the patient to, instead of showing you the prescription, get all the medications that the patient is taking. Because then when the patient gets all the medicines to you, he will not only get the medicines that you have prescribed, but also the OTC medicines the patient might be taking or any herbal medicines. And you can, at least you would know what all the patient is on so that you are aware of the potential harmful effects and you can eventually educate your patients regarding that. Now, you can use certain tools like Beer's criteria, stop-start criteria to rationally prescribe medicine in your patient. Now, promote rational prescribing and deprescribing. Always critically think before you prescribe or deprescribe a medicine to your patient. Now, encourage adherence monitoring. Always talk to your patient at every visit when the patient comes to you. Ask the patient what all medicines he's taking, what time, what dose, so that you can reinforce the patient to adhere to the therapy you are giving. And always collaborate, especially this is significant in Indian context, that collaborate across allopathic and alternative medicine practitioners so that you can take into account any herbal or Ayurvedic treatment the patient might be taking. Now, this is the Beer's criteria. This is provided by the American Geriatric Society, and it has been recently updated in 2023. So, the American Geriatric Society gives us a list of drugs that are potentially harmful for our older adults. And it also gives a list of drugs which should be avoided in certain conditions or should be used with caution. So the AGS Beer's criteria has an intention to reduce older adults' exposure to potentially inappropriate medications by improving medication selection. It educates the clinicians and patients, and also it serves as a tool for evaluating the quality of care, cost, and patterns of drug use in older adults. This is the stop-start criteria. This also identifies assists our healthcare providers by identifying potentially inappropriate medications and potentially omitted medications for older adults. It is also another tool which can be used to rationally prescribe in an older adult. So I would say that whenever you are writing a prescription for a patient, always rationally prescribe. You should have a clear diagnosis in mind. Always use the lowest effective therapy and avoid polytherapy. Wherever necessary, wherever you can, withdraw the unnecessary drugs. Beers criteria and stop criteria can be involved, and always involve your patient in decision making so that the patient knows what is going on, which drug is good for him, which is causing the possible side effects, and which drugs need to be avoided. Again, very important, medication review. At every visit, make sure to get a structured review of all the medications the patient is taking. Check interactions and always involve pharmacists because eventually they are the one who are dispensing the medicines. Now, patient education is of utmost importance. So always design a prescription which is very easy for the patient to follow. The drug should be mentioned clearly along with the dose, the dosage, when it is to be taken. So it has to be in a simple language so that the patient can understand easily. It might include certain visual aids. If the patient is not taking the medicine himself and the caregiver is providing care for the providing medicines for the patient, then the caregiver needs to be involved. Always respect the beliefs of the patient. Implement the brown bag session where you ask the patient to get all the medicine and you educate the patient on the dose and the storage of the medications. Always reinforce the patient to not self-start or stop any medicine. Teach the patient to recognize warning signs of adverse drug reactions and encourage the patient to use one pharmacy and visit one doctor at least should be aware of all the medicines the patient is taking. Now, what policymakers can do to avoid polypharmacy? One, prescription audits can be strengthened. National guidelines can be implemented for rational drug use. Promote pharmacovigilance programs, public awareness on self-medication risks, and integrate pharmacists into primary healthcare. Because in Indian scenario, sometimes the patient just goes to the chemist and takes the medicine and the doctor is not involved. So it is very important to involve the pharmacist as well. So these are the key takeaways of my talk, that polypharmacy is very prevalent in India, and it is not only a health risk to the patient, but it is also an economic burden to the public. So that is why economic burden to the society. That is why you not only need to involve the clinician, but also the public health and policymakers need to be involved in it. And public healthcare professionals are key to safe management. They need to be educated about the risks of polypharmacy. And I would say that polypharmacy is just not about adding a medicine or giving a prescription, but it is about critically thinking that the prescription you provide to a patient is providing the maximum benefit to your patient with the minimum risk of drug interactions or adverse drug reactions or minimum risks of polypharmacy. So thank you so much. And here I end my PPT. Thank you.